Hello everyone, my name is Angel Marie CUENTO and welcome to my first aid vlog. So most of us already know about the first aid, but to refresh our mind, let's take a short throwback to remember and to know better the first aid. So what is first aid? First aid refers to the immediate care or emergency that you should provide when someone is injured or ill until a full medical treatment is available. Also, it consists of the initial support provided to someone in the middle of a medical emergency. And for example, first aid is often treated to such as minor burns and cuts. For minor injuries, a first aid care may be enough. However, for those who have serious injuries, a first aid care should be continued until a professional medics have arrived. So there are 3 basic steps to follow if you might ever encounter an emergency situation. The first step is to always check the scene for any kinds of danger. Look for anything that might be dangerous like signs of falling debris, fire, or violent people. If the scene is safe, assess the condition of the sick or injured person. Don't move them unless you must do so to protect them from danger. The second step is to call for some medical help if it is needed. If you see or suspect the injured person that needs a medical care, tell a person to call the local hotline for emergency medical services immediately. If you're alone, then make the call yourself. Lastly, the third step is to provide care. If it is safe, stay beside the sick or injured person until a professional help arrives. Try to cover them with a warm blanket, comfort them, and try to keep them calm. Or if you have basic first aid skills, just try to treat any life-threatening injuries they have. Also, remove yourself from danger if the situation you think your safety might be at risk. So let's proceed to the next. So what are the supplies that can be found in the first aid kit? So the supplies that can be found in the first aid kit is firstly the bandages, gauze roll and pads, adhesive tapes, disposable gloves, safety pins, instant cold pack, elastic bandages, triangular bandage, emergency blanket, thermometer, antiseptic wipes, scissors and tweezers, face mask, and betadine and alcohol.
You arrive on the scene. Check the scene for safety. Check the victim for consciousness, gently tap their shoulder and shout.
Are you okay? Are you okay?
If no response, call 911 immediately.
You, call 911.
If the adult is lying on their stomach, turn them over into their back. They should be lying on a hard, flat surface. Check for breathing and signs of life. Watch their chest for any normal movement. Look for signs of life and breathing for no more than 10 seconds. No breathing or signs of life, begin CPR. Position the heel of one hand on the center of the adult's chest. Place your other hand on top. With your elbows locked and arms straight, lean over the adult's chest and compress the chest 2 inches in depth, 30 times.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
After 30 compressions, give breaths. Give breaths by tilting the head back, lifting the chin, and pinching the nose. Place your mouth over theirs and give 2 slow, gentle breaths, just enough to make their chest rise. Continue with 30 compressions and 2 breaths.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Continue CPR until you see signs of life, another rescuer takes over, or help arrives.
Just like shown in the video, before performing the CPR, you need to take note of these steps. The first step is to make sure the environment is safe. The second step is to try to wake up the person by tapping the person's shoulder firmly and ask, "Are you alright?" in a loud voice. Then move on to the next steps after 5 seconds of trying to wake the patient. The third step is to call 911. And lastly, for the fourth step is to check for the breathing. Tilt the patient's head back to open the airway and determine if they are breathing. If the patient doesn't take a breath after 10 seconds, start CPR. In performing the CPR, the following steps are: first, place your hands on the person's chest. Imagine the line between the nipples and put the heel of one hand directly on that line in the center of the chest. Then place your other hand on top of that hand and center your weight directly over your hands. The second step is to perform chest compressions. Push hard to a depth of at least 2 inches but no deeper than 2.4 inches. And fast about twice per second until the person responds. The third step is to give rescue breaths. If you have had CPR training and feel comfortable performing the steps, push on the chest 30 times, then give 2 rescue breaths. Lastly, the fourth step is to repeat cycles of 30 chest compressions and 2 breaths until help arrives or the patients wake up.